Prabhakar sir, Mr. Prabhakar, coming from the management background, I would like to know what are the considerations of COVID management. One year, first case was detected in Kerala in Jan 30th. So what are the considerations now?
Right. Thanks, Prithu. I think you rightly identified me as the management expert and put a strategy question. Yeah. Very quickly to say the tactics which all the government started under the central leadership was about the 3 T's of testing, tracing, and then treating. But today, I think it has evolved to what I call the 4I tactic. That is basically identify, isolate the people, inoculate them for the herd immunity in the future. So from the 3T to a 4I kind of a tactical shift which has happened. Exactly 12 months ago, Prithu, all of us were having this fear of the unknown. Right. Unknown enemy, we did not know what it was all about. Right. But since then, slowly but surely, the management principles around COVID have also evolved. Right. Now, I will take the 360-degree view of public health standpoint, societal standpoint, and industry standpoint, and give a quick roundup about how it is currently. Right. Now, the way I see is that, yes, all of us have had experienced some of the toughest lockdowns and the measures thereof, then the graded relaxation which happened over several months, so much so that today the air travel is back almost at about 80% of the last February levels. Trains, as we all know, are very few. Mumbai locals have just opened up a week ago. Right. Many offices, especially in the city like Bangalore, where I live, are still practicing the work from home. City is almost 40% empty on the roads. And elective surgeries, which concern this group, is that a lot of these have got deferred. Interestingly, the non-communicable disease burden which was there in the country, that actually took a backseat. People obviously either could not go or get tested and treated for several long months. Right. Now, after all these debacles, the economy is slowly limping back, so much so that again, the GST collections are of the record sorts. Now, after said, a lot of things have changed from those days, but several things have remained the same. That is the beauty of this whole management of COVID, the way I see. There are two fundamental things we have been looking at managing COVID around. One is to save the lives, and the second one is to sustain or improve the livelihood. I'll spend a minute on it. Right. Saving lives is centering around the CFR, the case fatality rates. Now, India's death rates, as we all know, is more than 1.65 lakhs as of yesterday night, and it is still counting. Right. Kerala, of course, as we all know, has had great success early on in containing the disease, but the second wave has hit us very badly. Right. India's CFR is definitely one of the lowest in the world, standing at 1.43% as of yesterday, right, whereas world's CFR is well above 2.2%. Right. In this chart now, I refer one of the recent articles which I read from a peer-reviewed journal. This journal is called Journal of Infection in Developing Countries, October 2020 issue. There was a paper based on a study by Edwin Asirvadam and the others. Simply stated, their conclusion is, what are the predictors of CFR? That is what they tried to study. Their conclusion was socio-demographic factors and the burden of the non-communicable. These are the things which are actually defining it. Now, based on these conclusions, the authors have pushed for focused strategies of early identification, testing, effective targeting of less literate people or illiterate people. Please mark these words carefully. Effective targeting of less of illiterate people, elderly, urban populations, and those with the comorbidities. These are critical lists. So, like the first speaker said, Kerala is a contiguous city-state, and urban kind of a population is high. And there are a lot of working and the other population, and the kind of mingling that happens. All these are clear indicators of what is required in Kerala at this moment. Right. Connected to this, there is a misplaced complacency about the CFR. When I said 1.43% low, should we feel happy about it? No, that is not. The low number today doesn't mean everything is hunky-dory, neither in the state nor in the country. We are lacking very precise age distribution of both cases as well as deaths. Second angle is the lag CFR, which means up to 18 days after the COVID clearance, also people have died, can die. Oftentimes it doesn't get reported. I'm sure all of you have heard yesterday what happened in Russia. From nowhere, cases have been recorded as 1.62 lakhs. It has gone to the third position in the world.
Right.
So people suppress, people don't reveal the real reason. So given these things, the CFR may not be a clear indicator in itself.
Right.
Now comes the second big agenda of the whole management of COVID, that is preserving the livelihood.
Right.
I think it is even more important, especially for a country like ours, which has a large and relatively younger population.
Right.
It's a good thing that as of yesterday, 1.32% of all the cases only were still active.
Right.
All over the country I'm talking about. No
Right.
doubt Kerala as of yesterday accounted for 41% of all the new cases in the country.
Right. Right.
5 states together are accounting for 81% of the new cases. This is where the challenge comes. So the final message is looking at both the goals of saving lives or saving livelihoods, we got to be relentless in testing so that the third wave or the subsequent waves we can avoid.